We will talk about seizure mimics today. Seizure mimics means those which are not seizures but appear as seizures. Generally, many of the parents do complaints of some movements or some event that they have witnessed in the child, and which might not be seizure. But we have to take the history, and we have to analyze everything in an orderly manner, and then only come to conclusion whether it is a seizure, true seizure, or a seizure mimic. Why it carries such an importance is that for seizure the treatment is entirely different, and the duration of the treatment is also entirely different, and it is little longer than the other treatments that we usually see. Let's say for fever or something, the treatment will be maximum of 10 days, 5 days to 10 days. But if the child is having a seizure and then if we have to treat it, the duration will be in years duration. So that's why it is very important for us to know whether the event that has occurred in the child is a true seizure or a seizure mimic. Again, as with any case, the symptoms will depend upon first mainly the age factor. At different ages, the child can have different presentations. Suppose if we take a very young newborn who is born, or let's say within 6 months of age, the most common events or the symptoms that we come across from the parents is after the child sleeps or when the child is awake itself, the child has little jerky movements of both the hands or something like that, especially in a very younger kids. So this could be jitteriness, which is a normal phenomenon in a newborn child, or sometimes decreased calcium levels also can cause this. So this is one important seizure mimic which will appear like seizure, like because the child will be having such movements of the hands and legs. That is one thing. The next common thing that we come across is that the parent tells that after the child has gone into sleep, the child has jerks of the limbs, like one jerk here, one jerk there, in the legs, or sometimes both the hands, both the legs, something like that. So they do get worried because we can clearly see that the child is jerking. The movements are a little different from the usual. So after ruling out the other causes, this could still be a benign sleep myoclonus, wherein it's a normal phenomena. For adults, if you just relate to it, as we just drop into sleep, you can also feel a single leg or hand jerking movements. This is a similar phenomenon that is occurring in children, that is especially less than 1 year of age. So that is one more thing. Next, as we move beyond this age, then we call something called as breath holding spells, wherein the child when suddenly has fear, somebody has touched the child very suddenly, or the child had suddenly fallen off from somewhere and then hit his head, or the child wants something but the parent has not given, or it is beyond the reach of the child, then the child can have something called as breath holding, wherein the child cries and then you can't hear the sound later. That means the child is not taking the breath in. Cry is expiratory, meaning when we exhale the air out, then that is the time when we get the sound of cry. And so if we are not getting the sound of cry, it means the child is not taking the next inspiration, that is the next oxygen dose is not going for the child. In that case, what will happen is the oxygen supply to the brain is then it comes down slowly, because of which the child can become stiff and can become blue and can have a couple of jerks, and then or the child can loosen their body so much that you will have to hold the child. These things are called as breath holding spells, especially when the child turns blue. They are called as cyanotic breath holding spells. Cyanotic is nothing but becoming blue. So these are one thing. These are not true seizures. Those breath holding spells can also be associated with true seizures, but it's very important to know whether these are just reflex seizures because of the breath holding or otherwise. So this is one more very common thing. And sometimes even a child with cardiac problem also can have this blue cyanotic episodes. So that is one thing wherein we have to differentiate the child, whether the child is having true seizure or something like this. Then the next common thing is vertigo. Many of us would have had this experience of vertigo, wherein you will suddenly feel dizzy, or you will suddenly feel that the whole room is turning around you, or you are just having this giddiness kind of thing. So this vertigo can also be experienced in children. And this will not present like typical adults because they are unable to express themselves. So generally if they have vertigo, they will tend to stand in the same place and not move their head, because head movement will cause the dizziness again. And they can have couple of vomitings. During the event, the child might not be fully responsive to you because the child is experiencing those symptoms. So depending upon the symptomatology and the preceding and the later factors, we will know whether the child is having vertigo or something else. So this is one more thing. And sometimes we do see this vertigo wherein there is some family history of motion sickness, meaning the persons in the family have this vomiting sensation during journeys, or history of migraine in the family is also pretty common in such cases. This vertigo is not age specific. This can occur throughout any age. So for the younger kids is a symptomatology that I have told. For an older kid, he'll be able to tell us whether how he is feeling. The next common cause is syncope. Syncope is nothing but having giddiness and then falling down. That is syncope. So we do experience such symptomatologies when we haven't eaten anything, or we are dehydrated, long hours are standing, so on and so forth. You can have such symptoms. For kids also, they can also have such syncopes. Generally, these syncopes are usually in the later ages. Suppose, let's say the child hasn't eaten anything at home and then have gone to school and then had to stand in assembly, let's say for half an hour or 1 hour. Then also the child can have this symptoms of syncope and then falling down. The first symptom usually the child tells us that the child will have some blackout in front of the eyes. He can't see anything, and the next moment what he remembers is that he doesn't remember his posture, but he does remember that distantly somebody are shouting and then somebody is talking to them, and little later they will regain the consciousness. So there is brief loss of consciousness in syncope. If the consciousness loss is little longer, they can have couple of jerks as well. We shouldn't get confused with these jerks to a true seizure, which is a very common point for getting confused. So this is one. And suppose, let's say the child doesn't have any such situations of dehydration. The child is just sitting, even then the child had syncope. Then cardiac causes, meaning heart related causes also, you should think whether there is alteration in blood pressure or something like that. So these are the common causes. And next causes, some kids with migraine do have initially the symptoms will not start straight with headache. They might be having some kind of visual auras. Auras are nothing but the preceding symptoms for headache. So wherein in the vision they can see some patches in the eye, and then they can see some patterns, which is also seen in one kind of epilepsy. So we shouldn't get confused with both of them, and we should analyze the symptoms properly, because the treatment of migraine is entirely different. So apart from these organic causes, meaning organic means there is some basis in the body that these symptoms are occurring. Some kids who have stress, who have taken stress in the school or at home, or they're having a difficult childhood or something, they will have something called a psychogenic seizures, wherein the child has seen the seizure or wants to have some attention, or doesn't know that he is behaving like that in that way, but the stress is coming out in the child in that fashion. And we generally see that in adolescent age group kids, they can mimic seizures, like they can put their eyes up, rolled up, and then can have couple of movements. There are few things that we can do to differentiate it. One thing is event capture you can do. We can connect EEG to the child, and then if the child is having the TVN and we clearly see that the child doesn't have any seizure related changes, then also we can talk to the child, understand his problem, and similarly counsel the child as well. So these are the common seizure mimics that we come across in clinics. For further doubts or questions, you can comment in the comment section. Thank you.